Many people will get growths under their skin that are called commonly lipomas. It's a firm little rubbery area. Typically they're the size of a grape, and you can kind of roll it around, and they become painful after time. They can grow and they can put pressure on adjacent nerves and structures. Most of the patients that I see with lipomas have 1 or 2 or 3, but I have some patients in my practice who have over 100 of them. And they're very self-conscious. If you want to go to the beach, some of them have large lipomas on their arm in exposed areas or on their legs. The good news is that they can be removed. Typically, I remove lipomas under straight local anesthesia. The day I see the patient, we can numb it up, make a small incision. The incision is usually smaller than the diameter of the lipoma. And I use a press and squeeze technique. Once it's numbed, we make the small incision and you press on the adjacent tissue so that you can deliver the lipoma, almost like delivering a baby, through a smaller incision, and it'll pop out. You can grow new ones. You can grow a new one in an adjacent area. And then that small incision is typically closed with a tiny suture under the skin. I like to see people back a week later to look at the wound. We do always send that tissue to pathology. We have it looked at under a microscope. Now, if there are 100 of them, we would certainly send samples, and we don't technically do 100 of them at one time. People that have substantial lipomas in terms of quantity or number or size will pick the most bothersome ones, and we'll do those. I think that it's easier under straight local anesthesia for the patient to have a small number removed, and then we may do it in segments. We may see them back yearly or every other year. But the lipomas, it's surprising how little information there is out there about lipoma surgery, which can easily be performed in New York. Now, an alternative technique to remove lipomas is with liposuction. Some people have more substantial lipomas that can be this large or bigger. Typically, we'll make a small incision, and you can put the liposuction instrument under the skin and vacuum the lipoma out. The disadvantage of doing it that way is you don't really know if you got it all out, so there could be a small amount left behind, and I explain that to the patient. But in reality, I've never had one reoccur that I removed in that technique. The advantage of doing it with liposuction is, if it's a substantial lipoma, is that it's a much smaller incision. Otherwise, you'd have to make an incision almost the diameter of the lipoma to remove it. One other thing about removing lipomas in terms of plastic surgery in New York is that in most places the skin is mobile, so you can make a small incision and you can move the skin around so that you can get around the lipoma with a smaller incision. We do it in an operating room under local anesthesia. Sometimes I'll have an assistant move things around, but the patient can go home right away. I've had patients travel here for lipoma surgery from great distances, literally out of the country. In that case, we would ask the patient to stay a short period of time, but suture removal could be arranged at home, or sometimes we can use dissolving sutures. But they are not going to go away on their own once you have lipomas. They only stay there or get bigger. And over time, they do typically cause pain and discomfort. They may limit motion as well. So there are many medical reasons for removing lipomas.